This computer. Tanse, everybody. Welcome to this podcast for Indigenous Psychological Services. We have a really amazing special guest with us, Dr. Karlee Fellner, and we use this podcast as an opportunity to really educate, empower, and just provide knowledge for those that are listening and, really tackling the stuff that we see with the Indigenous mental health or counseling. So, Dr. Karlee Fellner, would you like to introduce yourself?
For sure. Thanks so much, Lee. Tanse chanteho wia netsigasan, katoyesa ki netsigasan, Alberta Otinia, Karlee Fellner Munya Wikoin. So, hi, my name's are Good-Hearted Woman and Sweet Pine Woman. My English name's Karlee Fellner. I'm a citizen of the Métis Nation of Alberta. My family was removed from Beaver Lake Cree Nation through half-breed scrip and relocated just outside of Camrose, Alberta, which is southeast of Edmonton. I was born in Camrose, and when I was a year old, my family moved to Devon. So that's where I grew up. And from there, lived in Edmonton for a while, went to school in Vancouver, worked at the University of Calgary as a professor in Indigenous education and counseling psychology for about 10 and a half years. I resigned there last year, November 2023, and have since been back in full-on practice. So running Muskiki Wellness, which is Cree for medicine, and just refers to the medicines that we all have within us and within all of our relations to heal and rebalance ourselves and all of our relatives. So, yeah, that's a little bit about me.
Yeah, it's nice to have you. I kind of found you, stalked you, wanted to be your friend, fangirl you, and finally I was able to really connect with you and some of the things that you've been kind of bringing forward and paving the pathways for other psychologists. Would you want to kind of speak about that whole process of why, we talk about how Indigenous mental health or Indigenous counseling has to be so different?
Absolutely. So I did my undergraduate and master's degrees at the University of Alberta. And when I was studying my master's, well, it's really interesting. Let me go back a step and a half. Is growing up in Devon, this is kind of funny. Okay, this is before the internet was a thing. I didn't really know what a psychologist was. Like, I didn't really know about therapy. I don't think there were psychologists in Devon at the time. I didn't really know it was a thing. When I graduated high school, I just decided to go to U of A honestly because I had scholarships because of my grades. So I was like, I guess I'll go, I'll see what happens, right? So I go to the university, not knowing what I was going to do. And during my first year, some of my friends started telling me, oh, psychology is a really easy A. And I was like, awesome. I like easy A's. So I take psychology and I'm like, huh, like something that I literally didn't know existed. Again, little embarrassing, but whatever is what it is. And then I was like fascinated with it. I was like, whoa, like I just became really fascinated about understanding human nature and why people are the way they are and just understanding, some of the things I went through in my life and was going through and stuff like that. So whatever, long story short, I end up getting pulled into the field of psychology. So then I do all the things, get into the master's program there at the University of Alberta. And it was during my what was called the multicultural counseling class. Not ideal terminology, but that's not what we're here to talk about today. Um, my friend and I, in that course, we did a project just exploring, how therapists should be working with Indigenous people, right? So, I mean, I knew that I had Métis in my background, but it wasn't something that I didn't grow up practicing the culture or knowing the language or practicing ceremony or anything like that. So I knew that that was there. And I think that's part of what sparked my curiosity and like, this is what I'm gonna look at here. So my friend and I did this project And we're talking to all these people, going to community events, meeting with some elders, meeting with the students of what was then called the Aboriginal Student Council. And I was hearing everywhere I went that psychologists were honestly, I mean, I'm just going to say it, kind of fucking it up, right? Like, um, pretty much everyone we talked to quite a few people. Most of them said they would not see a psychologist ever. Some of them shared some, pretty scary stories about things that they'd experienced seeking services, just in terms of, some of the ignorant comments people would say, different even aspects of the intake process that were really alienating and super insensitive to trauma and the
Mhm.
things that people had been through. I mean, I could go on, but it was really that project that sparked me being like, oh, okay, this is a problem. Like psychologists are actively causing harm in community. And so from there, it's so funny because I was a person who I didn't like school growing up at all. I really didn't like it. So when I went into university, I was like, I'm just gonna get a degree. I'm gonna get out of here as fast as I can, right? 4 years, I'm out. I ended up doing 13 years of university
Wow.
education.
Wow.
I know, because I
Amazing.
did a 5 year undergrad co-op program where I worked at a psychiatric hospital for a year. And then I did my master's, and then I was not going to do my PhD, but it was literally that moment. It was that question. It was realizing this is an issue because I was doing a course-based master's. I had no intention of continuing on. I
Mhm.
didn't like research
Yeah.
at the time. So, fast forward, I take a year off, thought I'd apply to some programs, see what happened, and I ended up getting into UBC. So I went out to the coast, moved to Vancouver with this intention of like, okay, I'm gonna do Indigenous research, research that I actually love, because I love it when we get to use our own ways, and explore how mental health services need to be shaped to better serve Indigenous people. Because something's got to change, right? So I move out there. This is 2010. And at the same time, I start getting into it. I got really blessed because I ended up, it's only a cohort of 6 in the PhD program. In my cohort, I ended up meeting a brother for life, Roger John, who's an exceptional clinician out in Victoria. He's First Nations he's Statliam from the interior of BC. And so I end up meeting Roger and, some good conversations with him. And he was really like, gave me that little push I needed to to kind of go into exploring my own indigeneity and connecting with who I am as an Indigenous woman so that I could do this work in a good way, right? So basically what ended up happening is I started doing this research on best practices in mental health for Indigenous people at the same time as having my own personal journey and experience of connecting with ceremony. I just kind of went head first. I'm so grateful because I met mentors and, aunties and grandmas for life out there, who I'm still very close with and who are the women actually who directed me and guided me into Indigenous focusing oriented therapy as well. So all of that was going on. What ended up happening with my doc research is I ended up speaking with 16 knowledge holders, Inuak, Indigenous folks who had been working in mental health and health services of different kinds for many, many years. Some of them was like 4 decades almost. And but most of them, I would say, were over 10 years in the fields. And then I had a couple that had maybe less years experience, but a lifetime of experience in the system, having experienced different forms of addictions treatment and different mental health kind of treatment, stuff like that. So that's where I started was just looking at how do mental health services need to change to better serve our Indigenous people. At the time, I'm in a doc program. My supervisor, Carly, you got to narrow it down. So, I was focusing specifically on urban environments, but the findings, 95% of them or more apply to any Indigenous community configuration, right? There was only a little bit that was specific to urban, like things about serving all different nations at once and stuff like that, right? But um, basically, what I ended up finding in that work, the findings came out as a braid of sweetgrass. So the first strand was what's not working in our mental health services right now.
Mhm.
And within that first strand, the findings were the things that are causing harm, actively harming our people and communities. And then the things that are obstacles and barriers to the good work that needs to happen. So that was strand one.
Yeah.
Strand two was the medicines that are needed to provide the best possible services to Indigenous people. And in that, there's seven medicines. So I'll talk more about that after. And that third strand was how to make it happen. So the actionable ways of like, how do we create this change? Things like changing policies, funding practices, NIHB,
Um,
right? There could be a big conversation about that. NIHB was directly in my findings. People talked about that and some of the issues with that system too. So, so yeah, that was kind of the foundational work that started to articulate that. I will say, when I was doing that work, speaking with those knowledge holders, many of them were incredibly frustrated. Like they said to me, Carly, like our people have been saying this for years and years and years, and nothing's changing. Like nothing is happening. So in that, I really took on this responsibility of like, okay, I need to be a part of some concrete change as much as I can, to try to shift some of this stuff. And so again, fast forward, someone who had no intention of being in the academy, and I end up going into academia. I never had an intention of being a professor. I will tell you that. And the only reason that I did for the time that I did really was because honestly, like the honest truth is because I had a dream that guided me to in conjunction with something Joanna Archibald said to me when I ran into her on campus one day.
yeah.
So it was kind of this like, this really phenomenal Indigenous elder scholar combined with having this dream that's like, okay, I guess I gotta, you know,
Yeah.
do some time in the ivory tower. And so I did, and I'm grateful I did because I see how what I was able to do there, both in terms of carrying that work forward and doing a number of community-driven research projects that really brought to life Indigenous wellness and how we approach mental health from an Inuak Indigenous perspective, right? Which is really about holistic wellness. Um, it's about so many things, which is what we'll be talking about. But yeah, it gave me the opportunity to do that, and at the same time get involved in some of that systems and policy change, even, working on the task force with the Canadian Psych Association and Psychology Foundation of Canada to address the TRC in psychology, right? I'm really honored and grateful to have been part of and witnessed multiple apologies. The apology that came through that task force on behalf of the field of psychology
Wow.
to Indigenous people and communities.
Yeah.
And I was very grateful to have witnessed actually the apology from the APA,
Yeah.
the American Psych Association, as well. That was initially done at the Society of Indian Psychologists Convention down in Utah. So, we're starting to see some of those shifts, but a little bit like the TRC, it's kind of one of these things where, all right, the community has spoken. It's all out there. That
Yeah.
task force report says everything we need to know about the steps that need to be taken within psychology. Now it's about those next steps happening, right? Which is, mm, that's the piece
Yeah.
where we're seeing a little bit of struggle within these colonial systems, right? So that's kind of the broad story of the work.
Yeah.
From there, I'm happy to go into it, what the findings have been, some of the best practices, or whatever direction you like to take, Lee.
Yeah, yeah. Yeah, I'm really curious about those seven, the strand, when you said the strand of like this is that there was that seven strands or that of teachings. I think I'm really curious about that. Speaking
Yeah,
of braided sweetgrass.
yeah, for sure. Oh gosh. Now I'm just sitting here like, I should have had my the pieces of my bundle here with me, but it's okay. We can imagine. Um, yeah, so I'm gonna start. So those seven findings that came out, and I will tell you in all the work I've done since, because I was spending this time with these knowledge holders. It would have been 2013. So in the past 12 years since that time, this has only been reinforced. Like these seven medicines, I'm just like, yep, it's beautiful. So it came out as this bundle framework. So that first medicine was the tobacco.
Mm,
And, it kind of aligns with some of the teachings that were given to me by, some of the knowledge holders who've taught me, and by some of the knowledge holders in the research as well, of that tobacco being, the plant that gave itself to the people to communicate with spirit. And that tobacco in that bundle represents good relationships. It's the starting place. So when we're talking about mental health, which I'm actually going to stop using that term now, because that was like, if I could say there was like a number one finding,
yeah.
like the
Client.
overall,
Let's talk about client.
right?
They're
Oh,
people.
we can talk about all the terms.
Yes.
But terminology is important, right? Because words carry spirit or energy, however people think of it. Words are energy.
Yeah.
Words have spirit, and so the terms that we use are really important. So I'm gonna stop using mental health because it's funny. I didn't even have that in the findings, but I pointed it out right away. Like,
Mhm.
first finding, let's stop using this word.
Yeah.
It doesn't even apply, right? Like, this is really about overall wellness.
Mhm.
Um, and the ways that even the body is speaking about trauma that might not be manifesting in mental health per se, right? But it might be coming out as diabetes or
Yeah.
cancer, or, So anyway, so no more mental health. We'll kind of put that to the side. But just so people know, we are talking about mental health services here. But know that you are working with a whole person. So yeah, that first finding is good relationships. So how do you, as a service provider, as a clinician, ensure that you are creating good relationships with the people who you're serving, right? And yes, I do not use the word client anytime I can avoid it. It's really about the people that are coming to us for help. And it's critically important, actually, to start to shift that language, because the language of client, therapist, psychologist, whatever have you, creates an arbitrary separation between us, right? And you get different schools of therapy that talk about equalizing the power imbalance, things like that. From an Indigenous perspective, like, we are just moving that power imbalance totally out. Here's the reality. I am a human being that is fumbling through this life just as much as the person that's sitting with me coming to me for help, right? Like, we are all human beings in this experience, and no one person is better than any other or has any particular expertise or anything over the other.
Mhm.
So it's just throwing that out the door. One of my elders, who I really consider, I don't want to call him a grandpa because he's not old enough to be my grandpa, but we'll say uncle. Wee Thug, Richard Wright. I worked with him at the Indian Health Board of Minneapolis when I did my internship there to finish off my clinical training for my PhD. He talked about using the term, he's an Anishinaabe from Leech Lake, Minnesota, using the term Manitou, the term for spirit,
Mm.
right? So it's, you're Manitou, I'm Manitou, we're coming together as Manitouag, you know? Um, and so that's the terminology I like to think of because that's really what it is, spirits coming together to do this work. And we're just here in our human bodies kind of thing. So really working on creating that good relationship there. And then moving into the moving through the medicine bundle, the second medicine or another one of the medicines um, is about identity. I also don't like the term identity. So just FYI. For the purposes of communication, identity, but really it's about relationality because the issue I have with the term identity is it's really based in that individual, right? So you have your Euro-Western conceptualization of the person as being this individual that's somehow isolated from all of their relations, which we understand as Inuak, Indigenous people understand, and many other, people across the world get it. That's not possible. Even if you just look at biological realities, the fact that we rely on water and nutrients from plants, and if we eat meat from the animals, to build our bodies, right? Like we are the land. We are inseparable from the land. We are literally made of it, So it's not even possible to be this isolated individual. So relationality is really what that's about. So it's understanding, for one thing, the person in relation, having that understanding that each person is interconnected with their families, with their communities, with the broader nations that they're a part of, humanity as a whole, with the land, the water, the air, all of the animals, all of this physical world that we are a part of, and the physical cosmos, as well as the metaphysical. Our ancestors who have gone on, the generations to come, any other metaphysical relatives and energies that are impacting us. So there's this understanding of that relationality, and then attending, when we are working with folks who are coming to us for help, attending to that relationality with them, to a sense of belonging for people and how important that is, And so, again, there's a piece here that sometimes for urban folks, that sense of belonging can be even more challenging, right? I mean, it can be for anybody, honestly, no matter where they live or where they've been brought up. But you have folks who have been obviously directly, explicitly, intentionally separated from their families and communities through acts of colonialism that were aiming to do exactly that, right? You've got the 60s scoop that's ongoing, right? The millennial scoop, it's still happening. You have the residential schools, you have all of the ways that Indigenous peoples have been removed from their communities, right? The half-breed script process, which is what happened in my family. And so you have a lot of folks who have also intentionally been disconnected by colonialism from their families and their roots, and not to mention, of course, it being illegal to practice ceremony until 1960 in Canada, 1978 in the States, right? Like that's recent.
Yeah.
That's really recent. So just attending to that relationality, that sense of belonging is so important. So important.
I
So
also
there's
want to say it's so difficult, especially if you have trauma. Like
yes.
that relationality is like just so difficult when you have so much happening inside.
Yeah, yeah, exactly. Right. And it's just it can be layers of trauma upon that as you're also trying to connect,
Yes.
right? And so, yeah, so that's such an important part of our wellness as Indigenous peoples and moving forward. That was a big thing that came up. So another really important piece was Indigenous knowledges.
Mm,
So that third part of the bundle was looking at Indigenous knowledges, which I actually represented with um, plant medicines as part of the bundle there. And so it's really thinking about how do we bring Indigenous knowledges into our work to understand. This
it's really
is
important.
such a critical piece. Yeah, I can't even emphasize how important this is. So this is where, for instance, the knowledge holders I spoke with, and again, it's only been reinforced and repeated since in my academic work, in my personal experience, in my own cultural mentorship relationships with knowledge holders who are teaching me. We need to understand wellness, suffering, difficulty, challenges through Indigenous knowledge systems, right? So, basic down to the root, Indigenous focusing oriented therapy does an excellent job of articulating this.
Mhm.
So, whatever, and again, another word I can't stand, symptoms. Okay. But again, for the sake of communicating, don't mind my air quotes. I use them all the time. Symptoms. The symptoms people are experiencing. So whether that's anxiety, that's depression, that's flashbacks, feeling triggered, suicidal thoughts, you name it, whatever it is. And we can also get into the physical here, right? Heartburn, diabetes, cancer, you name it, anything we're experiencing is a conversation that's coming through our body.
Mhm.
And that conversation is coming through to guide us to optimal balance, harmony, and wellness. Um, so this includes, by the way, experiences that we enjoy, right? Like joy, happiness. Those are also conversations that are letting us know, like, you're in alignment. This is good medicine for you. This is helpful. Um, but those challenging ones, which people have a heck of a time with in today's world, because the dominating colonial narrative has told us you are supposed to feel good all the time. You're supposed to be happy all the time. You're supposed to like live this awesome life where you go on vacations and you have a nice car. And, I mean, it's all narratives and stories that feed capitalism. Like
Mm,
that's their intention. It's all intertwined in this whole system that's self-sustaining and supporting itself, right? So stepping out of that into Indigenous knowledges, we're coming from a different place of understanding that when people are suffering, it's indicating that there's an imbalance of some kind. That imbalance might not even be personal to that
mm,
person. So that person might be experiencing anxiety, but it's really not about that person's anxiety. There's actually no such thing. Again, this is where we're getting out of the id, out of the identity piece, out of that individualizing of the colonial paradigm. Because we are always in relation, whatever messages are coming through our difficulty, our suffering, can be coming from anywhere within that web, right? Often multiple places. So there might be a little piece of it that's ours. But then, it's like, oh, okay, a lot of this is part of the collective. Look what's happening in the world today. There's so much going on, and so many people are experiencing what the collective is experiencing, right? Look what's happening to the land. We feel that in our bodies in different ways in our different relationalities and relationships, right? So that Indigenous knowledges piece is about coming out of this paradigm of pathology,
mm,
disorder, disability, deficit,
mhm.
and returning to original Indigenous knowledges, which are thousands of years old psychologies, right? Like we're talking about thousands of years versus some decades here, you know? So there's a lot of wisdom there. And it's that understanding that, yeah, when we're experiencing suffering or discomfort, there is information there, there's medicine there that's letting us know, like,
Mm,
hey, that bring this medicine here to help balance this and bring this more into harmony, not just for yourself, but for the world, right? So, again, I might be experiencing a lot of anxiety. And when I take time with that and kind of sense into that, it's like, oh, I need to get out on the land more. Okay, this is happening because there's all this collective stuff in my body and I'm not discharging it. So I need to start going for walks outside more. People do this without being conscious of it,
Yeah.
right? They'll know I need to go for a walk. I need to get out for a hike, and then they'll feel better after. And they may not always be conscious of it, but when we become conscious of it, we can do even more work in that way for ourselves. And so yeah, it's moving forward with those indigenous knowledges, understanding that like, okay, I'm not messed up,
Hmm.
or I mean, looking at the narratives about indigenous people and you hear these stories, right? Of like, whoa, you've got over 500 years of trauma in your DNA. I'm sorry.
Yeah. Yeah.
Fuck that.
Mhm.
Fuck that. Because that that message right there, that tells everybody,
Yeah.
hey, by the way, indigenous people are screwed, right? Like, what hope do you have?
Yeah.
Over 500 years of trauma in your DNA, right? Or if you're an indigenous person, it tells you, yeah, like I'm screwed. What am I going to do about this? What can I possibly do? It's like it's this debilitating condition,
Mhm.
you know?
Yeah.
That's a bunch of BS.
Mhm.
So, yeah, trauma shifts things in our DNA, but guess what? Our DNA also holds all of the survivance of our ancestors.
Yeah.
I mean, there was a direct attempted genocide here in Turtle Island and many other places of the globe, actually. And so for us to still be here, it's like we've got so much wisdom and knowledge in our DNA. Are you kidding me?
Yeah.
Like, we know how to survive genocide because we have. And yes, there were people lost along the way, a lot of people that were lost along the way, and that continue to be lost in that. Their lives continue to be taken by the ongoing genocide. And yet also, we are still making babies actually, I've heard at the highest rates of any subpopulation, right? So we're growing, like we're not going anywhere. We're
Yeah.
here.
Yeah.
And all of that survivance is in our blood and our bones,
Mm.
as well as thousands of years of wisdom and knowledge of how to live in relation with the land in a good way. And those indigenous knowledges are not just for us. They are for the world. The world needs Indigenous knowledges today. Indigenous knowledges are what will allow humanity to come back into living in a good way with the planet and all of our relations of the physical world here and metaphysical, of course, and to continue as a species, right? Because colonial knowledge systems are completely unsustainable. We're seeing that left, right, and center, right? We will destroy ourselves as a species if,
Yeah.
as humanity, we continue on that colonial trajectory of destruction. So these indigenous knowledges are key, and we can actually bring them into our practice as clinicians to take a step out
Mhm.
of these pathologizing paradigms, right? What is the DSM good for? And my response to that is the only thing it's good for right now is the way that it supports people because of the way that the system is set up, you
Yes.
know?
Yeah.
It's so important for people to know the DSM is socially constructed. The DSM is only knowledge in one worldview among thousands or, who knows how many worldviews exist on this planet, right? Or knowledge systems. This is just one
Mm.
that defines these pathologies. And we don't need to buy into that. Some of the knowledge holders that spoke with me during that first project, they spoke, for example, there was two of them actually that independently brought up people who today are diagnosed with Down syndrome. Traditionally, before colonialism, they were seen as some of the most gifted folks in the community because of their incredible gifts for unconditional love and for presence. like for being present with whatever they're experiencing, right? It's like that complete joy of like smelling a flower and seeing a person that you love,
Yeah.
and they didn't deal and don't deal with the same afflictions of the ego as people who don't have that particular gift, right? So this is a very different way. There's no disability there. There's no disorder there. The DSM and all those disabilities and disorders and dysfunctions that only exists because those are only an issue within a capitalist colonial paradigm that says we need everybody to fit in this certain bell curve of normal to be able to be cogs in the capitalist machine, to work these kind of jobs, to do this kind of school, and that's like we just push that out the window
Yeah.
when we come into Indigenous knowledges. So this is something that all clinicians really could do, is to step outside of those paradigms of understanding and to say, whoa, 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 wait a minute, because that book, the DSM,
Yeah.
diagnoses, psychotropic medications, those were all in that first strand of things that are harming our people,
Yeah.
right? There's a really good quote by one of the knowledge holders in my dissertation where, he says when the settlers first came,
Mm.
that they thought we were crazy. They started labeling us as crazy at first contact, and it hasn't stopped.
Yeah.
So it's just kind of this ongoing legacy of pathologizing,
Yeah.
and all that does is continue to oppress our people, keep our people down,
Mhm.
um, to the point where people are now taking on those labels themselves. And again, I get it, in the system we live in, you may need a diagnosis to obtain, some supports that you need. Things like that. I have no issue using diagnosis for that. That's coyoteing the system. That's like, we got to do what we got to do to help you out, right? Because we do live in a colonial system right now.
Mm.
However, does that mean that you have this disorder? No, you know.
Yeah.
So that's a big part of that Indigenous knowledge piece. And then shifting into the next piece of the bundle was living a good life. So
Mm.
let's look at Indigenous ways of living a good life. And there we see a lot of the medicines that help people get well. It's for a lot of folks, it's ceremony, like ceremonies that resonate for them, that fit for them. If that's something that could, because that can address that relationality piece too and help them look after their spirit.
Yeah.
It Traditional foods was a really important part of that. Not only are traditional foods and wild foods honestly the healthiest and most nutrient dense, but they feed our spirits,
Yeah.
right? Um, it's funny because I remember when I was pregnant with my son, I was craving, like, I have Scandinavian ancestry or Nordic ancestry, and I was craving like Nordic food all the time, right? But that's in our DNA, our traditional foods that go back to the land that we come from, right? And for me, wild meat from here is a big part of that too, right? Like the deer, the moose, the elk, the bison. Oh my gosh, like that's, if I can live off that every day, it's life changing, right? And you look at that, that's going to impact someone's physical health as well,
Yeah.
right? It's that holistic piece. And then all the other things that
Mm.
are part of our wellness, humor,
Yeah.
joy, it's like that's such an important part of our wellness. And it's like Indigenous folks, my Inuak friends are some of the funniest people I know, right? It's just like that's a part of who we are. Um, and dancing,
Mm.
whether it's powwow dancing or, it doesn't matter. It's whatever fits for people. But that movement, that dance, like we've always moved, always, always, always. You gotta move when you're living on the land. Um, and I remember when I was living in Minnesota, hearing one of the guys out there, he was talking about the men's traditional dance from a Lakota perspective, and what he shared, and and this may be different than what other people know, but what he shared at that time was that the men's traditional dance, the way that he'd been taught, was men dancing the stories of hunts that they had been on or battles that they had been a part of. And I just remember that striking me in the moment, like, wow, like that is
Yeah.
PTSD prevention, right? Like you are preventing trauma
Yes.
from, you know, because there might have been, especially if there was intertribal warfare and conflict. But even on hunts, you know, people could lose limbs,
Yeah.
but some people could lose lives, right? Like living off the land is not, I mean, I couldn't do it right now, right? Like it's not easy. It's not, I can't imagine sometimes, but I'm like, that strength is in my bones and blood. It's in there somewhere. I'm just not quite there yet. But yeah, like, you know, they were dancing out those stories. So they're not, that's going to prevent trauma from being held in the body, right? Like you're dancing it out into the land. So that dance is wellness, you know, singing, drumming, and like there's research out there that shows that drumming, singing, so like is helps people with their wellness physically and mentally. And we know, you know, spiritually as well. So yeah, that was another piece is like, what are those teachings of living a good life? Because Inuit knowledge systems are inherently prevention and treatment. You know, like if you start to live those ways, it's going to help you, you know, be stronger in the face of the adversities that are coming your way. And it's also going to help you to process and deal with some of the things that you've been through, right? So, Gerald Visner, who is White Earth Anishinaabe from Minnesota, incidentally, I came across his scholarship when I was doing my doc work, and he talks about survivance. And that term, like as soon as I learned it, I was like, this term's coming with me into psychology because he's a scholar in Indigenous literature, right? I'm
Yeah.
like, we got to bring this over here. Like our field needs this term because, you know, resilient,
Yeah.
doesn't quite
I
do
know
it.
we're resilient, but yeah.
Right. And some of the issue I have with the term resilient is it can be very patronizing,
Yes.
which Western psychology tends to be,
Yeah.
and is very patronizing. It's like, oh, you're so resilient. Look at you go. You're so strong. You got this.
Yeah.
I don't like that. It makes a person small, right? And really diminishes a person. Whereas survivance, you know, visitors talking about yes, right? Like
Yeah.
the ways that we have survived through attempted genocide, survived thousands of years again, living with and on the land, and that our survivance stories are all encompassing, right? Like indigenous peoples don't just exist in relation to colonialism. Like no way. Like we exist in our own right, and we have these like rich histories that extend back hundreds of thousands of years before colonialism. Colonialism is just a little blip in recent history if we draw out the timeline. You know, I remember when I was in Minnesota, one of the knowledge holders there, Nancy Bordeaux, she used to do those presentations and show the timeline, right? Like, here's
Yeah.
colonialism, here's the, it's like, yeah, it's just a little piece,
Mhm.
right? So those survivance stories are our stories of everything of who we are, right? That the trauma piece, like that's something we've experienced, right? And when we look at colonialism and people who, you know, intentionally came colonizing and inflicting this violence, most of them had been colonized prior, right? So we're going back here, the Roman Empire morphing into the British Empire,
Yeah.
and all of the damage and harm that's caused. I mean, those folks are highly traumatized, heavily traumatized, right? It's just more years back
Yeah.
in their DNA. And so it's coming and kind of, you know, taking that trauma out on the people here.
Yeah.
And so it's just this, you know, Eduardo Duran is always my number one recommendation to everybody. Healing the Soul Wound. Everyone has to read it, every human on this planet. It's amazing. Because he talks about that spirit of violence, right? It's like that spirit of violence, energy of violence that those folks were bringing over. And it's like, you know, here today, we're in the wake of that,
Yeah.
right? And actively working to heal that. You know, the founder of I Fought, or the grandmother, I should say, of I Fought, Shirley Turcott, like she says, Indigenous peoples are not the victims of complex trauma. We're the leaders of complex trauma.
Yeah.
You know,
Yeah.
absolutely. The world needs this knowledge
Yeah.
of how to shift these traumas. And like Indigenous peoples are leading the way in that, as well as other folks who have been marginalized and oppressed in these systems, right? A lot of our BIPOC relatives, LGBTQ2
Mhm.
plus relatives, like we're seeing that, the leaders in healing are these ones that have had all this violence
Yeah.
inflicted upon us, right? So that's all part of that
Mhm.
acknowledgement in that medicine bundle. Just to kind of wrap up on the bundle piece, the next part was land. So the
Mm.
importance of land
Yeah.
in our services and our practice with Indigenous peoples. Something like Indigenous focusing oriented therapy. I mean, it's such an explicit part of IFOT, right? But even outside of that, it's like the importance of people getting out on the land just for wellness in general, right? Uh, and however the land is coming into the space, like having those stones there, learning some basic ways to work with land.
Oh,
um, I do a lot of work, and obviously when I was a professor, teaching a lot of students as well, um, with non-Indigenous folks who ask, well, how can I do this, right? How can I bring stones into therapy? And I say, this is land, right? And we all have this relationship with land. And actually, it's really good if everybody works to cultivate and strengthen their relationship with land again. That's what will guide us back to living in a better way with our relations, right? So, anybody can learn that, like holding a stone,
yeah.
you know, this is our oldest relative in the physical world. That's just, again, a biological fact, right? That's a physical fact, is that these are the oldest things on the planet. We can hold those stones and we can give those stones whatever energy it is that we need to release. Again, basic physics, right? Energy cannot be created or destroyed. It can be transferred, it can be transformed. So you can transfer energy, very basic. You can transfer anxiety into there, right? That stone can take that for you, take some of that for you. Um, and so even just having the land in the space, learning to work with land that way, I remember one of the tools of I thought that when I learned it, I was like, this is so simple, but like it's so effective, is just taking the tissue. I'm trying to see if I have any here, but I don't think I do. Um, maybe you do. Maybe not.
Mm.
But what have I got? Well,
It's like this.
I've got, yeah, there we go. Some like just that basic brush down,
Yeah.
right? That you've got, again, organic materials, whether it's cotton or tissue, which is, that's tree, right? Paper, tree. That can help take that for you, and it's been amazing for me to see in practice how powerful that can actually be for
Yeah.
people, you know? Um, I remember working with a person who had experienced a sexual assault, and they were talking about, the guilt and the shame and the guilt and the shame. And and we talked about how that wasn't that person's guilt and shame. That was the guilt and shame of the person that had violated
Yeah.
them, right? Uh, Literally, like we did that brush down. We grabbed facial tissue and we just started. I did it with the person as well because that vicarious, right? It helps. Just started wiping off
Yeah.
guilt and shame because that's not yours. That's not yours. The land will take that. And literally, that did it for that piece, for the guilt and shame piece, right? It took that from that person and they were no longer carrying that. So yeah, just the ways that we can work with land, and then obviously getting out on the land. And sometimes that's having sessions on the land, right? Like and that's something I love in my own practice is doing land-based practice. And it's funny, just recently I had someone asking me about, once Muskiki's up and going again, because I'll be coming off of mat leave in a few months here. So do you have an office that you work out of? And I was like, well, Well, it's a lodge, it's a teepee. It's out on the land.
Yeah.
And there's land there, right? So there's land and what I love about doing work from within the teepee or the Mikiwap is that we are right on the land there, right? So you can still be inside, if it's raining and stuff, we're still sheltered from the weather. I mean, these are thousands of years old structures, okay? So they're pretty good. We can have the fire going in there, but we've got our feet on the land, right? And there's that direct
Yeah.
immediacy with the land there, which is just a bonus, right? It's great. Um, so yeah, so there is that piece. And then yeah, I'm just trying to think about gather my thoughts. Um, another one of the medicines was responsibility.
Mm.
It's so funny. I'm realizing I left the last medicine is actually the first medicine. It's kind of got me all over the place. So this is number six, and then I'll talk about seven, which is actually the first one. But responsibility was one of the medicines in there, and that actually speaks to the responsibility that clinical service providers need to take to do their homework,
Wow.
right? If you are a clinician
Yeah.
who is working in mental health,
Yeah.
I'll use the term
Yeah.
right now for the sake of communication. I don't care if you're a clinical social worker, if you're a nurse practitioner, psychologist, counselor, whatever. If you are supporting people
Yeah.
in the area of mental health and health more broadly, um, you need to take responsibility for educating yourself
Yeah.
in real ways. I'm just gonna say it, Lee, and I know you're with me here. Um, I am super grateful that our College of Alberta Psychologists has a requirement for people to do continuing education in Indigenous, related to Indigenous people.
Hmm.
I'm not, however, happy at this time with what's being accepted for that, right? So when I talk about responsibility here, I am talking about learning the history of colonialism, learning the way that colonialism continues to manifest today, the ways that genocide is continuing, that we're still losing people at disproportionate rates
Yes.
because the attempted genocide,
Hmm.
it won't be successful, but it's still ongoing, right?
Hmm.
Um, the ways that systems and structures are continuing to be so racist and discriminatory, child welfare, healthcare. I mean, I could go on and on, right?
Yeah.
But
Yeah.
this is what people need to come to understand. This isn't about going to read a book that was written by an Indigenous author, right? Yes, do that.
Mhm.
Like,
Or watch a movie. Do
or
you?
watch a movie. Oh God. Yes, like yes, do that, but
Mhm.
don't consider that your continuing education.
No.
Do some meaningful learning with
Yes.
community.
Yeah.
Do learning that makes you feel uncomfortable.
Yeah.
If you happen to be a person with Euro-settler ancestry, do some learning that unsettles the settler within.
Mhm.
I'll just name that book
Yeah.
right there, right? It's an incredible book, Unsettling the Settler Within.
Hmm.
Um, read that book. Read a book on white fragility. Start to undo the colonialism that's already a
Hmm.
part of who you are. Myself, I'm Métis. I'm mixed. I have both settler and indigenous within me, right? That's something I'm constantly having to contend with. They don't like each other sometimes, right? It's
Yeah.
and also I was raised in a colonial society in the English language, a colonial language. I have tons of decolonizing to do for myself. It's been an ongoing journey and it always will be, you
Yeah.
know? And so it's like, get into the real work, learn about the uncomfortable truths, right? And learn also about the things that we're talking about here today, right? How can you understand the DSM differently? Understand the colonialism of that publication, of the processes that are associated with it, of assessment practices. There's so much colonialism inherent in psychology, the ways that we're taught, even looking at the history of psychology. Look at all these white guys. Like, what worldview are we in here? It's very obvious,
Yeah.
right?
Yeah.
And no one in the history of psychology ever talked about these thousands of years old psychologies that I've had the privilege of learning from these folks, right? So really taking responsibility to undo those colonial ideas, systems,
Yeah.
manifestations, and approach your practice in a humble way. Like there is no such thing as cultural competence.
Yeah.
Cultural competence, if we're going to talk about cultural competence, what that needs to mean is coming into session saying, I don't know anything, you
Yeah.
know, but you still better know as much as you can, right? Like that doesn't mean coming into session and asking that person who's coming to you for help,
To
oh,
teach.
you teach me about my culture, right? You
Yeah.
tell me what your people have been through. Oh, tell me more about the residential school experience that your parent went through. No, 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 no. You
Mm.
do that work on your own.
Yeah.
You know, you get out there, you attend community events, have meaningful conversations with elders, connect with people, offer tobacco, say, "Can you help me
Yeah.
learn to be a better clinician?" Because I have folks coming to me who are Indigenous and I want to do right by them.
Mm.
I don't want to perpetuate these harms. And for Pete's sake, read that task force report. It's number one.
Yeah.
Number one on your responsibility list is read the task force report. Number two is read Eduardo Duran, Healing the Soul Wound. Paulette Reagan, Unsettling the Settler Within, right? Um, and go from there because that task force report has all the info in there needed of like how do you actually start to make change, but whether you're involved in psychological research,
Yeah.
education,
Yeah.
assessment, or clinical practice, right? It's all in there.
Mhm.
So that's a big part of it. And then just to wrap up with the last medicine, which is actually the first, but it's funny because I was picturing the bundle, and that's why the blanket that holds the whole bundle together is love. So it, that was the number one thing.
Mm.
Besides that mental health isn't mental health, but that's the number one thing was love, bringing love to our work, a genuine love. And again, a part of this is like you're a spirit, I'm a spirit. We are two human beings, or, however many, whether it's family, group, couples. We are human beings navigating this rough and bumpy ride of life together, right? And yes, we may have vastly different experiences, very critical, especially to acknowledge dynamics of power, privilege, oppression. It's part of the responsibility piece, is to acknowledge those things. However, nobody's better than the other here in this life. And certainly, no clinical service provider is an expert on what somebody needs to support them, right? Like, no, me as a therapist, me, Karlee, as a psychologist,
Mhm.
I have a bit of knowledge on how I can facilitate a process to
Mhm.
support someone listening in to the medicine that's already coming through them, right? That's it. I'm just a facilitator. I am here to support you connecting into the medicine and the wisdom that's already coming through you.
Mhm.
Every individual, every family, every community has everything that they need to heal themselves. Everything,
Yeah.
right? So that genuine love is like we love each other as relatives. And I do love the people I work with, you know? And I like to share this story sometimes, and I'll be brief, as I imagine we might be running out of time. Or maybe we're out of time.
My kids might be coming back from in at 3:30. So just
Okay.
yes.
Okay.
Mom, that's what you're gonna
That's
get.
good.
Mom.
Good. Super quick wrap up. Um, but I remember working with this person. This was many, many years ago, that they were referred to me. And when that person was going to come in and see me, I was hearing all of these narratives around about them of like, ah, yeah, good luck. This person's been like getting services for years and years, and you're not going to get anywhere. And I don't know, why people felt they needed to say that, but it's fine. Um, and there was a whole like file for referral of like, here's this person's history clinically and all of this stuff. Didn't even open it once. I, yeah, not so secret. I don't look at that stuff.
Yeah.
I don't care because I'm gonna be there with that human that's there with me. That's good relationship, right? I'm gonna get to know that person as they show up with me. So this person comes in and, they had been struggling in their relationship with alcohol. As my my Nookum, my adopted Nookum put it, trying to heal themselves with the wrong medicine. I love that. I
Yeah.
love that when we talk about addictions.
Mhm.
Also, don't use the language of addictions. But it trying to heal herself with the wrong medicine. So this person had been struggling with that. My job as a therapist is not to get this person clean or sober, right? Like that is not what I am there for. I am there to be with that human as they are and to support them in the way that they need support that's going to be helpful to them, right? And um so that's how I worked with that person, and essentially what our work ended up being was just um, really strengthening her relationship with her spirit. She was starting to put out, prayers more and offerings. And we didn't even talk about the alcohol. That's not what it was about, right? It was just about supporting her, helping her with some tools to be able to set down a lot of what she was carrying. Because this person was so gifted in carrying and picking up so much for her family and community. She was just weighed down by it, right? And so it was just the unlayering of that, very simple, strengthening relationship with her spirit, nothing groundbreaking or earth-shattering or huge, right? But I remember when my time was wrapping up for, the work that I was doing there, and I wasn't going to be able to see her anymore. We had to end our work together. She didn't show up to her last couple sessions, and before I left, thankfully, she ended up giving me a call. And she just said, you know what, it was too hard for me to come in and say goodbye. But I just want to let you know that this is the first time in my life I can think of that anyone has respected me.
Wow.
Yeah. And it's just because I was just with her, right? Like I was just there with her. And she said, I love you. And I was like, I love you too. I remember having this like immediate like
Oh,
colonial thought of like, oh,
oh
Carly,
no.
you just said I love you to some, to a client, right? This is the colonial brain. You just said I love you to a client. Oh my God, what's gonna, oh, because I had to like get that colonial voice away. I was under supervision at the time, right? I was able to talk with my supervisor about it and chill out a bit. And just acknowledge that we don't need to go to the places where love has been
Yeah.
warped and perverted and polluted within the colonial paradigm, right? No, this is like an authentic family to family, like we are related. Not literally, as far as like, the way that colonialism talks about relations and blood relationships and family in that way, but we are related as relatives who are interconnected in this planet, right? Like you are a relative of mine. And of course we love each other and care for each other. And that was such a powerful finding in that work. So um, really bringing that genuine love to our work, that's what fuels all the rest of it. When we are driven by love for the people in the communities we serve, and that's what we bring to the table. Responsibility is not an issue. I will read every flippin' book, I will attend workshops. I will go to ceremony. I will make myself uncomfortable and do things that make me nervous and scared because I love these people. I love my people and I need to do the best that I can by them, right? So And everything else falls into place by that way too, right? Like my ego or whatever attachment that I have to what I was taught in psychology school, that goes out the window. It doesn't, you know, it can't survive in the face of that love.
Right. It sounds really easy, Carly. It sounds really easy to be having a human to human experience and easy to care and to love in that way, in such an authentic way. And yet we're really asking providers and practitioners to think very differently and be different, be very differently. And also there's this vulnerability that we have to be with others that we're asking people to do. And I think that's where we get the hiccup is psychologists need to come from this place of knowing, instead of being like, I got to know and I got to, get you from here to here instead of just being with that client. Because that a client, here we go, to that person, because that person knows their own way of getting there. And we're just really kind of walking along and walking with them and beside them. And so I definitely, see, and I'm sure you do too, of those practitioners that really struggle with that human to human experience of that, taking that professionalism away where we can still be professionals, but
Mhm.
we're doing it in a way that is really supporting the person.
Yeah, exactly. And that is all about humility, right? Like it is all about checking the ego,
Yeah.
and looking at actually part of that responsibility medicine too, talked about looking at your intentions. What are your intentions in becoming a psychologist, a
Yeah.
social worker, whatever it is you are, in the work you do? What are your motivations there? And if you find yourself of like, oh, like I'm getting satisfaction out of telling people how to live their lives or feeling like a savior, right? I mean, the savior complex is a thing. That's in my dissertation, one of the knowledge holders, it's in there, called it the missionary position, right? Like that's what it is. We're gonna come save you, right? And it really is this power over oppressive stance. And so if folks are hearing this and having a hard time imagining humility and vulnerability and humanness, that's where I would encourage them to start to do their own work, right? What is it about your ego that's feeding off of this? Because that's not healthy, and that's going to really put some of the folks that you're working with at risk of harm. It's not okay. So we can't be here to feed our own egos, and we can't be here just to make money. Like these motivations, people need to check. And on that last one, like we see that in community all the time, right? Folks will take contracts to work on reserve in First Nations because of the money.
Yeah.
Please do not. Please do not. Um, unless you're going to do good work. You know what I mean? Don't get me wrong. We all have to eat. We live in a colonial system, but like that should not be the driving motivation, right? Like, nor should saviorism. That's just as dangerous.
Yeah, and I think those intentions are also really felt. And what I see, going to those contracts in community, this is the difference. The difference of a very sound practitioner, I just want to say practitioner, is kind of the understanding it is not, I'm going to say client, it's not the client's job to build a relationship with you. It is your job as a practitioner to build that relational with the person you're working with. Like it's your job to get out there. And I know some of those contracts, I'm getting really heated about this, they get paid for this when a person doesn't show up. So they don't have to do the work. And that's the intention. And people can feel that intention. And so if we're really going to work in those communities, like we really have to be building those relationships. And it's not the person's job to get to the office. That's us. Yeah.
Exactly. And like if you are doing that kind of work, you get out to community events, you get out to ceremony,
Oh,
right? Like
yes,
A-
yes.
and people will hold on to the code of ethics sometimes as an excuse. And it's like, actually, no, let's talk about the code of ethics here, right? Principle number one, we're doing no harm. We need to be of benefit to the people we work with. If community is community, and if you put yourself out in community, people won't know who's your client or who isn't, right? Who's coming to see you for help. That, and you have those conversations for them, right? You're gonna see me around community. How do you want to deal with this? Put it in their hands,
Yeah.
right? Because I find people will use that as an excuse sometimes to say, well, I can't go to the powwow. I can't go to the sweat because my clients might be there or they are going to be there. And I don't, yeah,
Yeah.
that's just an excuse, right? Like you got to get out there. You got to learn the ways of the people that you're serving, learn their worldviews, learn their traditions, learn their culture, and connect with
Yeah.
people,
Yeah.
right? Be trustworthy, be authentic, be real, be a person people can relate with.
Yeah. Well, Carly, my kids are coming in, so I'm going to stop recording, but I just really, it's been an honor and I'm just fangirling you the whole time. I don't know if you've seen, I'm like, just like listening and really appreciative of everything and taking the time to do this. And please, I know I share lots of your information about like your research, and I know you're going to get that organized, but if you can also bring that and send it over, we try to put it on our website to connect providers, practitioners, and again, clients or people that really want to focus on healing. So thank you so much. I'm going to stop recording and just give me 1 second. Thank you. Oh, wait, that's not stop recording.